Welcome back to Liquid Lunch. Couple tracks there from Chris Cadell and the Records. Marla.
Can you actually enunciate what you just said?
No, that's my.
Oh.
Hey, what's that?
Wait, what is that?
There's a giant.
Oh,
Wait,
I
let's see it again. There's a giant.
This
What is
statue.
it?
It's this.
Let's see. How does it?
It's this.
Marla, there's a.
It's my torso. There you go. There you go. Ooh.
That's great.
And now also my camera's like
Now this
too-
is a model
too
of what
low.
you're going to look like, Marla, after you spend some time with our next guest, Dr. Paul Oakley, who's here. Hi, Dr. Oakley.
How you doing?
Should we call you Paul? Can we call you Paul? What should we call you?
Dr. Paul's good.
Dr. Paul.
That's
Okay.
what all my patients call me.
All right,
That's fine.
great. No, before we get into this, whereabouts do you practice? Where's your
Up in
office?
Newmarket.
Newmarket. Do
Yeah.
you know Daryl?
Do I know Daryl?
Yeah.
Yeah,
I always ask that question. Anybody from Newmarket? He's my friend.
Can I ask a question too?
Yeah.
Do you know Nancy? Because I have a friend. Actually, she's my accountant. I'm going to see her tomorrow.
Oh. I know we're down in Toronto, but Newmarket's pretty big.
Are
It's
you
got
near
about
Elgin
80,000
Mills?
people.
Are you
Oh, I
near
know.
Elgin Mills?
No, more like Highway 9, Davis Drive,
Davis and Young?
Davis and Yonge.
It's
Yeah,
on Yonge?
that's a major intersection. No, I'm on the other side of town actually.
Oh.
Oh, like Davis and Leslie?
I'm at Leslie Street actually in Gorham
Oh.
Street,
Okay,
Oh.
there you go.
just right off
Okay.
the 404.
Okay.
Right on. Okay, great.
I've been there for about 7 years now.
Are you from Newmarket originally?
Yeah, unfortunately.
Oh, that's
no,
great.
No, I grew up there.
Really?
Yeah.
So maybe you do know Daryl.
So
'Cause he
maybe
also
I
grew up in
do.
Newmarket.
I know a few Daryls.
I know Daryl, and Daryl.
Which one?
From the
Yeah, I
Newhart
know,
show,
I know,
Daryl,
I know.
and Daryl.
I know.
Okay.
Okay,
So
great.
how long have you been doing?
So I've been a chiropractor for 7 years,
Mm-hmm.
and I grew up in Newmarket. I did my undergrad up at Laurentian University in Sudbury. I did a kinesiology degree, and then I went on to Queen's University, did a master's degree in biomechanics, and then I went down to the States and did chiropractic college, and that was in Davenport, Iowa,
Great. No,
Sorry, why
the
did you
corn
want
capital.
Why did you want to do this for a living? Snap people's necks.
Okay. The spin doctors, right? Okay. No, I didn't know what I wanted to do until I was halfway through my graduate program. And then actually I went to a chiropractor and they greatly helped me with my neck. I had a neck problem. And then that's when I decided that's what I want to do.
can we talk about that a little bit? I mean, what
Sure.
was the problem? And then just describe what happened and how you got relief from that chiropractic treatment.
Okay. Well, actually, I'd met this chiropractor. He had this booth set up in the local mall. And I was just talking to him one day because I was taking a graduate course in spinal biomechanics. And so I was questioning him about chiropractic, how it works, and all the ins and outs of that. And we had a really good talk for about 45 minutes. I don't know if he appreciated that because a lot of people were walking by, potential patients or whatever.
Right.
But anyway, about a month later or 6 weeks later, I woke up with a big kink in my neck. I couldn't really turn my head. It was like stabbing pain, like sharp pain. So I went to see him. I saw him, and he did x-rays. He assessed me, and then he made some recommendations, and I followed through. And so he helped me greatly with that immediate problem. But then I also got the bigger picture about what chiropractic is all about. And it's a form of healthcare without drugs and surgery.
Right. Now
Yeah.
you were taking some pretty heavy science biology courses, right? About the spine.
Oh,
right?
yeah, anatomy and
Yeah.
physiology courses, yeah.
Now, I mean, in some circles, sometimes chiropractic gets a bit of a bad rap. I mean, they just got delisted
Yeah.
from OHIP, for example. I mean, just
Yeah, that was back in 2005, but
yeah, but still, I mean,
yeah, that was a big hit.
A big hit to
Yeah.
the community. When you were taking these courses at university, studying the spine,
Yeah.
you weren't doing it in a chiropractic context.
No, I wasn't, no.
Were you getting what was how did they view chiropractic in that context?
Actually, that's an interesting question because when I was helped by my chiropractor, then I went around and I asked everybody I knew at Queen's, my professors and other colleagues, like students, what they thought about chiropractic or whether they've ever been to one. And I would get two different, like bipolar kind of opinions, like those who have been helped or had friends or relatives and family helped. They were very positive towards chiropractic. And then those people who had never actually gone themselves or have heard so-called like horror stories were kind of negative about it. There wasn't many people indifferent, and I felt that was kind of interesting.
Yeah. And it's still that way. I mean, you talk to people, and you're going to get that kind of divergent opinion. And people tend to have fairly strong opinions about it one way or another.
Yeah.
Right?
Very much so. Yeah. People either love them, swear by their chiros, or they hate them.
Yeah, you're right. You're right. But really, those people who are negative towards chiropractic, usually they have never experienced it themselves, or they went to one chiropractor and it didn't kind of work out. But you've got to realize that chiropractors are really like a fruit and vegetable department in a grocery store. There's over 200 actually different techniques, named techniques, that they could apply to your spine and your body to try to help you. So if you go to one and the techniques, they don't match and you don't get the results or you're not happy, you should actually go to another one and try a different kind of technique.
Like and I'm not quite sure what you mean by techniques, but it seems to me there's completely different approaches to chiropractic.
It's the approach taken by the doctor,
And some specialize in a certain approach, a certain, I guess, sub-genre or sub-school of chiropractic.
Yeah, absolutely.
Now, do you yourself take one of these genres and work with it?
Yeah. Fortunately for me, I had my master's degree in biomechanics before I went to chiropractic college, so I did my research when I got there and evaluated a whole bunch of techniques, and then I chose the one that I believed was the most scientific. Okay, and that's the technique that I practice now. It's based on a posture and spinal correction, doing a traction methods. So when patients come in, we do a comprehensive, thorough evaluation, including spinal x-rays. Then we put them on a corrective program, including corrective exercises, adjustments, and tractioning techniques to fix their spine and their posture. So it's kind of like a good analogy is like I'm like the orthodontist within chiropractic.
Right.
Do you know what I mean?
So
I focus on the structural postural correction.
And with orthodontists, that'd be like the braces, right?
Exactly.
Just putting things back the way they should be.
Exactly, yeah.
Right.
But then at the same time, I can be the general dentist who would do the checkup on the teeth because I can just come and give spinal adjustments for temporary relief.
Okay.
Yeah.
All right.
Now, do you really believe that it's necessary to snap somebody's neck?
Well, when you refer to snapping, that's just one form, one technique. That's the manual manipulation is what you're referring to.
Okay, give me another technique so that one doesn't have to have that.
Yeah, so there's drop table technique, and that's where the table, it's called a drop table. All the different sections of the table can drop, and you would be positioned lying down on it, either face up or face down, and the doctor would, position your body and position their hands and put forces using the table to assist in the different adjusting.
Are you suggesting that the part of the table disappears from what's holding the head and then the neck drops?
No. It's just the table would drop only a minute amount, and that's called drop table. There's a whole technique around that.
I've seen those tables.
Do you have
I've been
that?
on those tables.
Do you
I
have that
actually
yourself?
have that. Yeah, I do.
Yeah. So, okay. Now, does the technique that you use primarily, does it have a name?
Yeah, it's called chiropractic biophysics.
Okay.
Chiropractic biophysics, yeah.
Now, can you just give us an overview of what this technique is?
Yeah. You know what? It stems back to, chiropractors have been looking at posture since the beginning of chiropractic, okay, which is just over 100 years, okay? But the problem is that traditional manipulation or adjusting techniques don't typically correct posture, okay? So to correct posture, there was a technique developed in the 70s called Pedibond technique, and they used body weighting. For example, if you have forward head posture, they noticed that if you put a head strap around but weight at the front of your head, then your muscles overcompensate and pull your head back. So if you actually walked around with that, retraining the muscles to hold your head and neck back, you could actually correct your posture.
Okay.
They could do that with the shoulders and hips and everything as well. So a doctor named Don Harrison got into Pedibond technique. He actually started instructing for Dr. Burl Pedibond, who founded Pedibond technique, okay? And then he discovered a new way to work with posture. He actually discovered a new way to assess posture. In other words, he had an engineering degree, and he applied engineering principles to evaluating posture. And basically, you know, I guess a little bit of physics here is that everything in space could be described as rotations or translations from on an orthogonal axis from the origin.
Mm-hmm.
Okay, so when you apply that to posture, you know, when you look at my head and neck, my head on my shoulders, I could be shifted to the left.
Mm-hmm.
That would be a positive X translation or side shifting, or I could be the other way.
Mm-hmm.
I could have forward head posture,
Mm-hmm.
or actually I could be back, or I could be taller or shorter.
Mm-hmm.
And really, you need an X-ray to see that.
Mm-hmm.
But if you could apply that to describe posturally, the head related to the thorax or rib cage, and then the thorax related to the hips, and then also the hips related to the feet, three-dimensionally. So it's actually the most fundamental way to look at posture. So then Dr. Harrison presented this to Brill Pettibon, but he wasn't interested in changing his technique. So then Dr. Harrison in 1980 branched off by himself and created chiropractic biophysics.
Okay, before
And that's
you go
the origins of the technique that I practice.
All right, so from what you're saying, what I'm getting is that basically looking at the body that way, evaluating every part and its relation to the next part down the chain, and assigning those values on the three-dimensional graph, right? You can actually come up with a mathematical description of the posture.
Yeah, very easily. Yeah.
And so you know where.
But it doesn't have to be like a mathematical description. It could just be visually. This is the way you are. You're shifted here. You have forward head posture.
Yeah.
You have a low hip on the side.
Okay.
So then the way to correct that would be to recommend exercises and traction techniques in the opposite of those.
Would you still put the weights on?
Well, we don't use weights. We use traction techniques, which
Okay.
actually do include weights.
All right.
Yeah. Fulcrums and stretching the body basically in the opposite of their presenting or bad posture.
So if your head's forward,
we would stretch it backwards. And there's a variety of different ways to do that in the office. So my office looks more like it's open concept, looks more like a gym because we have lots of different traction equipment around.
I see. Interesting.
So you put people in traction and hold them in a position for how long?
Typically 10 minutes at a session.
Does that do enough? 10 minutes?
Well, like I said, it's kind of like bracing the teeth, right? People wear braces for a year, 2-3 years.
Yeah, but it's on permanently. Like they don't let go of the brace in 10 minutes.
So when patients do corrective care in my office, they come 3 times a week, and we go in blocks of 12 weeks or 3 months. And then we expect a percentage improvement, and we determine that by X-ray. We have our own X-ray facility on site, and we generally get excellent amount of correction at that amount of time. But some people aren't finished then, so some people need like 6 months or even longer, depending on how bad their posture was to begin with, and how quickly their spine changes, how stiff it is, and how much arthritis they might have as well.
Sure, but you've seen results almost like a total correction in posture within a 12-week period, say?
Oh, absolutely, yeah. A lot of people can get
And then,
that.
then are they fixed after that, or do they have to go back for maintenance care? Or
Yeah, it's a great question. Yeah, we always recommend maintenance, typically a couple times a month. It's kind of like...
Wow, that's a lot. So it's like the rest of your life, a couple times a month, you have to go see you.
Well, if you think about it, who has a dentist? The majority of people.
But they go twice a year, not twice a month.
Yeah, but I think your spine is a little more important than your teeth.
Well, it's funny. Well, I don't know. You make these parallels to dentistry, but yet the frequency of the visits and the correction are not at all the same. I mean, not a lot of people can afford to go twice a month for the rest of their lives.
Well, you know what? You've got to realize that a lot of people who come to see me, they've been suffering from, say, neck or back pain or headaches for, you wouldn't believe it, but some people 20, 30, 40 years.
I can't believe it. Just the thought of any kind of chronic pain like that
So
drives
these people,
me crazy just to think about it, that somebody would be in chronic pain for that kind of length of time.
Yeah. So if we can actually help to correct them and actually cure their headaches without surgery or medication, just naturally, because their alignment of their spine was way off because of car accidents, sporting injuries, traumas, or whatever, then they're ecstatic. We've changed their life.
Mm-hmm.
And so asking them to come a few times a year to stay well and healthy and on top of things and not let things deteriorate again, they're totally on board with that.
Now,
Can you change somebody's posture if they are already in their 60s and have come to you?
That's a good question. Basically, it's never too late. However, if someone's really hunched over, we're never going to get them perfectly upright again. However, we can get some significant improvements, and a lot of time it's enough to relieve their chronic aches and pains that they suffer from.
You know what? I would say that maybe even, I would say never say never. You never know. Somebody's got the determination, who's got, maybe they're doing some other healthy tech. Maybe they're wearing immortality rings, that it could actually work. Now, you brought this.
Oh, yes.
You brought
Yep.
this.
Chastity belt.
It would be certainly. Can you tell us what this is all about, Dr. Paul, and sort of just what can we learn from this?
So this is the spine core brace. Okay, this brace is the first dynamic and corrective brace for the correction of scoliosis. And scoliosis is a curvature of the spine. The spine should be straight or very close to it.
Mm-hmm.
So the definition of scoliosis is having a curvature of the spine from the front view of 10 degrees or greater.
Mm-hmm.
And the big danger of scoliosis is that when it's discovered in children, when they go through a growth spurt, the magnitude of the curvature can actually grow or get worse very quickly. And
I remember when I was in school and I was a kid, there was at least a kid or two that had some serious scoliosis problems.
Yeah.
And it was really rough on them.
actually 2 to 4% of the population has scoliosis. Yeah.
Okay, so this chastity belt, as Marla calls it,
is the spine core brace.
Okay.
The spine core brace. There's actually a pediatric version, which is this one on the mannequin, and there's actually an adult version, which is, I don't know if you can see that.
yeah.
So the bottom part is a pair of shorts instead of the belt kind of system.
Mm-hmm.
Okay. So actually the shorts are much more comfortable. But so this was actually invented by 2 orthopedic surgeons in Montreal in the 90s. And how this brace works is that there's a lower part of the belt system, or in the adult version, the shorts,
Mm-hmm.
which it simply serves as an anchoring point for the corrective top part. Okay, and these are a series of kind of like elastic, kind of like bungee bands, and there's 4 of them. If we turn this around here, this is called the bolero, and this serves as the anchoring point for the corrective bands. And there's 2 that go over the shoulders, the 2 that go under the arms, and they could be oriented around the torso and body. There's actually 22 different configurations that could be put around your body, and it
Depending
depends
on the curvature, where it is, and that
exactly
sort
depends
of
on the
thing.
curvature and their posture.
Mm-hmm.
So it takes about an hour and a half-ish to actually brace a child or adult with this brace, because what happens is we have to determine the corrective movement or position of the person. So in other words, if they happen to have their torso shifted and rotated,
Mm-hmm.
then the corrective movement would be to do that, to pull them in the opposite. So it would be unrotate them and shift them the other way.
Mm-hmm.
And then the bands would be configured around them to actually do that.
Mm-hmm.
So then their body and their posture is under this constant corrective forces. So as they move around in the brace, it's retraining the muscles to hold their spine in a straighter position.
Right. It's kind of like braces for the
Yeah,
spine, really.
yeah.
Now, for something like this, wouldn't you have to put this on every day?
Yeah, this is actually worn for children. It's worn 20 hours a day, and they recommend 2 2-hour breaks. And if the child is going through a growth spurt, the research has determined that that's when this is most effective to get the maximum correction or reduction of curvature. There's been clinical trials showing that this can actually reverse the curvature and straighten out the spine.
So for any kids especially that are suffering from scoliosis, this offers some hope, right?
Yeah. And so this is typically worn a minimum of 18 months. Yeah. And at the end of the 18 months, if they're still growing, and they're not done growing, they would continue to wear that until they have finished growing. And for adults, with the shorts, they would typically wear that for back pain relief. And they wear that about 12 hours a day. They don't have to wear it to bed.
Like lower back pain or any back pain?
People with a crooked spine, they can have all sorts of back and neck related problems because of that.
Mm-hmm. Can this actually, for a child who's got scoliosis, can this actually, straighten their spine permanently?
Yeah, well, scoliosis is very difficult to treat. So, typically we can never get the spine exactly straight again. But the big danger is, of course, if the curve gets bad enough, like 40 degrees or greater, then a lot of orthopedic surgeons want to do surgery. And they fuse the back, they put rods in the back, Harrington rods, and then their total biomechanical functioning of the back is totally compromised for the rest of their lives. And there's a lot of activities they will never be able to do.
Yeah.
And so, parents and children coming in with scoliosis, they're desperate to find a solution.
Without surgery.
Exactly.
Yeah.
And, unfortunately today, the spine core brace, even though it was invented in Canada and is used around the world, it's not very popular in Canada. However, it was featured in Maclean's magazine in 2008. So a lot of people find me because of that Maclean's magazine article and through going to the Spine Corporation website, and they find me. And, you've got to realize that the alternative to this soft brace, which is very comfortable and easily worn under clothing, is typically it's this brace. This is called the Boston brace. You can see here, this is only about 2 years old, and this is from Sick Kids. So the only alternative is this hard brace. And this is worn approximately the same amount of time, almost all hours of the day. And this is a very cumbersome and awkward and uncomfortable kind of brace. And not only is it awkward and uncomfortable for the child, but it's socially scarring because all the other kids aren't wearing this kind of, Frankenstein sort of thing.
Whereas this thing here, you don't even notice it really, right?
A lot of kids tell me that their friends don't even know they're wearing it.
Yeah.
Yeah.
Okay.
And here's
Yeah.
another one, by the way.
I remember seeing ones like that.
This is
growing
the
up.
Milwaukee brace. And this was actually, these two braces were both donated to me by patients, spine core patients. And a lady in the mid-30s who I just braced, an adult with chronic back pain, and she does have rods in her back. She got the surgery. She actually wore this for 4 years as a teenager.
I think I remember seeing kids.
So it
wearing
didn't.
this.
I did. So it didn't correct her the
So it-
surgery, and she
Well,
didn't
so
correct
this-
her wearing the
This did
brace.
not help to prevent her from getting the surgery. And unfortunately, because these hard braces have been around for a long time, there's lots of studies have been done, and they found that forcing the spine unnaturally into a straighter position doesn't help because the spinal muscles that support and move the spine actually decondition over time. So you take the kid out of wearing a hard brace like this, and then
His
the
muscles
spine is weak, and it falls into the same curvature, and often it's even worse.
So is this brace more effective? This modern brace, is it more effective?
This is definitely the best option that actually exists today for scoliosis. and trying to
Setting
prevent that
aside
surgery.
that it's lighter and easier and less stigmatizing, is it more effective?
It's definitely more effective. Yeah.
That's
Yeah.
good.
All right.
Do you have any concerns about the amount of radiation with the X-rays every time you go to a chiropractor and they X-ray? I know it's like would make sense to want to see how the bones are before you manipulate them.
Yeah.
But what's the concern about the amount of radiation?
That's an excellent question. I get that question a lot. When you look at the big picture, you always weigh the risk to benefit ratio. Okay, so if you're going to get health benefits from getting either a spine core brace or chiropractic treatment, a couple medical X-rays to alleviate your chronic ailments that maybe you've been suffering from for years is that there's virtually no risk. Okay, and when it comes to radiation exposure, you've also got to realize that in daily life we're exposed to radiation from all over the place. Like for example, if you've ever taken an airplane ride, you get a lot of exposure to radiation from cosmic rays. We get it in our water. There's a lot of foods that are actually minutely radioactive. Potassium 40 in our blood is slightly radioactive. So just sleeping with your spouse in the same bed for a year is the equivalent. You'll get the same equivalent of radiation over 1 year as a neck X-ray, for example.
Well, so
See,
that's
Marla,
good that I'm
you
single.
You can get
That's good
X-rays.
that I'm
You can have more X-rays now.
I knew you were going to turn to me and say something. No, I'm really glad that I'm single right now temporarily, but we'll see what happens. Usually, the answer about that radiation question is you get more radiation in a can of tuna.
Well, you do now.
Mercury,
It's Japanese
the mercury
tuna.
stuff and all that. So, oh boy, don't get anything from Japan right now. But is it imperative that the patients get x-rayed before you manipulate, or can you do manipulation without the x-ray?
Right. You know what? Most chiropractors don't take x-rays these days, okay? A lot do. And for the techniques that we do in our office, we have to. Because if we're going to be tractioning or stretching your spine to correct your posture, we need to know the exact contours of your spine. Because I don't have x-ray vision. I don't know if your neck, for example, could be straight. It could have the normal C curve or actually have a reverse curve, which is very detrimental. And the different configurations of a curvature in your spine would determine exactly which precise traction method I would apply to correct your problem.
Yeah, somebody told me that if your chiropractor does have x-rays, then they know what they're doing, because they're actually, that's the tool they need to be able to identify and figure out what the problem is. They need to be able to see what they're working with.
Otherwise, a lot of times they're just guessing. And one study that came out said 66% of patients have, this is an x-ray study. They determined that because there's a lot of bone anomalies, which is very common in humans, especially around the low back and pelvis and hip area. And a lot of other people have suffered from previous older injuries that have healed, things like that. 66% of the time, based on having x-rays, chiropractors would actually change the treatment protocol they otherwise would have followed. So I believe it's very important to get x-rays, especially in just the first time you go.
Plus, they give you that little lead shield to protect your boys.
Yeah,
or
right.
your girls.
Yeah, right.
Okay, Dr. Oakley, anything else you want to leave us with? Anything else you want to let people know that you do?
Well, other than correcting the posture through our innovative techniques, CBP technique, and doing the spine core bracing, I don't think so. I think we've covered a lot.
But the spine, just for a moment,
Yeah.
because the spine, there's so much that relies on the spine and the nerve system.
Yeah.
You want to just sort of, make the case for, like, you really got to have your spine functioning.
I don't know if
properly.
you can see this picture right here. Maybe.
There you go.
I can get it.
Here,
Do
let
you
me
want
see
to,
if I can. We're going to, here. We're going to, I don't know what we're going to do. But anyways, just talk about that.
Sure, yeah. The spine is so important because it houses and protects the nervous system. Your body's computer is the brain and the nervous system. So what happens is the brain inside your head sends energy signals down the spinal cord and through all the nerves, like speaker wires kind of, okay? And they go to all parts of the body, all your internal organs, all your muscles, everywhere. So if you have bad posture or misalignment in the spine, it can interfere with traction, irritate nerves, which will create inefficiencies in those messages being sent back and forth from your brain to your body. So a lot of times dis-eases or dysfunctions in the body or pain or discomfort is caused by an interruption, by the spine being out of alignment. So in other words, a lot of so-called diseases today get labeled or named as diseases or conditions that are attempted to be treated by, pharmaceuticals.
Right.
And we know from the research now that how the dangers of pharmaceuticals and a lot of times the ineffectiveness. And so a lot of common conditions can be helped or alleviated altogether with chiropractic care.
And what are some of those conditions that people would not think could be treated with chiropractic?
Well, there's the obvious pain syndromes like neck pain, headaches, and back pain, but there's other things like urinary incontinence, asthma, heart palpitations. Mm-hmm. So when I say this, I'm not saying that chiropractic can cure all these things. However, you don't know unless you try chiropractic whether it can actually help these things, make them less severe, less often, mm-hmm. or maybe even alleviate them altogether.
And maybe that's the real, because I think often when people use pharmaceuticals, it's really just covering the symptoms or masking the problem. It's not dealing with the root cause, right? And that's what you're doing. You're dealing with the root cause of this stuff, right?
Exactly. That's
okay.
Right.
Which is the cervical bone that affects paralyzation? If you could become paralyzed, what is the one where they go, if it was just C6 instead of C5?
So cervical refers to the neck bones.
Right.
There's 7 bones in the neck.
Right.
That was Marla's first mistake. She thought it was a different part of the body.
No, I thought it was the neck. When people break their neck and then they become paralyzed.
Yeah, it's the neck. Cervical spine.
Right, because they always
neck.
say C6 and C5. So which is the one? it ranges from C1 to C7. Which is the
Exactly,
one
yeah.
that makes or breaks?
Well, if you were, for
Walking.
example, were in a car accident or had a major fall or trauma, it's basically the very upper neck, like C1 or C2. If that were to be dislocated, it would totally choke off the brain stem, which is the base of the brain, and that's where the centers that control your heart rate and your breathing are centered.
So that's when people get hung. That's what they want to break. But is it
Yeah.
which one is it? Is it 7, 6, 5, or 4? Well, they always say if it was just one lower, you'd be able to walk. If it was just one higher, you'd be able to walk. Which one is it? That's what I'm asking.
Well, usually it's the upper area, but I don't. I'm not sure what you were referring to
All
be
right.
honest.
Okay, it's okay.
Yeah.
I was just curious looking at
Marla's
the map.
just doing her research. She's does amateur chiropractic on the
Yep.
side, right?
Yep.
So she's
Dr.
Don't try
Marla,
that at home.
Dr.
That's not
Lukoff.
cool.
Oh, I had a patient last
Definitely.
night emailing me for some sex tips, and Dr. Lukoff.
well, we'll have to talk about that
Yeah.
a little bit later in the show. But Dr. Paul Oakley, thanks for coming in today. If people
Thank
want to
you.
get in touch, maybe they know somebody that's got some of the problems we talked about
Scoliosis,
today,
yeah.
scoliosis.
Bad posture.
How can they get in touch with you?
Well, the name of our clinic is the Innovative Chiropractic Center, Newmarket. The phone number is 905-868-9090. Our website is innovativechiropractic.ca, and also scoliosisgta.ca.
Great. Okay. Thank you. InnovativeChiropractic.ca, scoliosisgta.ca.
GTA.ca, yeah.
Great. Great to meet you, Paul. Thanks
you,
for coming
Hugh.
in today.
Thank you, Marla.
And
Thank you.
we're going to take a little
Oh,
break.
here's
Actually,
the X-rays.
do we have?
Yeah, there's some X-rays.
Are we going to play? So we've got the Ruby Spirit here. Do we have some Ruby Spirit to play? Okay, let's do that. We're going to come back with the band right after this. LiquidLaunch, ThatChannel.com.